It's Mental Health Week in Ontario, and many people are struggling with the impacts of COVID-19. According to a new study produced by Nanos Research, 13% of the 1,049 Canadian respondents they surveyed reported feeling stressed all the time that month. Only 4% said they felt that level of stress before the pandemic. Another 33% said they were feeling stress regularly in April, while only 17% said that was the case a month earlier. The Ontario government says they realize being isolated from family and friends is having an impact on people's well-being, and it's creating stress, anxiety, and depression in those who never struggled before. As a result, they are investing in resources which people can use from the comfort of their own home.
To support those struggling with mental health during these difficult times, our government has invested $12 million into virtual and online mental health supports. And this week, we're rolling out expanded access to those critical supports at no cost to patients. These mental health supports can be accessed safely from home. You can take an assessment and receive support from a therapist.
It's been even more of a difficult time for frontline personnel who are working around the clock in our hospitals and long-term care homes. Premier Doug Ford says they especially need to have proper supports during this time.
They're the ones in the trenches. They're the ones working 12-hour shifts. Their jobs can be stressful and demanding, but every day they get up and they go to work. They help people and save lives. They're absolute heroes. They're superheroes, if you ask me.
The support comes at a time COVID-19 cases continue to grow among Canada's most vulnerable population. As of May 7th, Ontario had over 19,000 cases of the virus, with over 13,500 people being reported as recovered. Many of those infected are residents of Ontario's long-term care homes, with 24 institutions in Ottawa reporting an outbreak of COVID-19. One of the latest institutions in Ottawa to be hit hard by COVID-19 is here at the Peter Clarke Long-Term Care Facility. 4 residents and 5 staff members have tested positive for the virus. It's the biggest outbreak in a city-run home. In a memo to Council sent over the weekend, Community and Social Services Department General Manager Donna Gray said facility-wide COVID-19 testing of all residents and staff will begin at both the Peter Clarke and Gary J. Armstrong homes on Monday. There is also concern with how quickly long-term care homes are getting their personal protective equipment. Health Minister Elliott says the government has been focusing all their supports on these homes, adding their deliveries will come 24 hours after they're placed.
We have issued a number of directives for many weeks, including most recently that there are no people allowed to visit long-term care homes except for if a death of their loved one is imminent. We have employed the use of hospital workers to go in to provide both infection protection and control, as well as for staffing. And of course, we have the assistance of the armed forces.
And on Friday, Ontario's long-term care minister, Mary Lee Fullerton, said a time will come to discuss the scale, scope, and terms of a review of the system in these homes, but added the government's priority today must be to protect people's lives and continue to bend the curve. All forms of review are on the table, she said in a statement to Twitter, but right now and since day one of this pandemic, our number one priority is protecting the health and safety of all Ontarians. That includes the most vulnerable members of our society, including those residents in long-term care. And we do have an unfortunate update to this story. Sadly, 2 more residents at Peter Clarke have tested positive for COVID-19, bringing the total number of residents infected there up to 6. Sadly, one of those residents have passed away from COVID. Charlie Senack, WIN News, Ottawa.